All right. Good evening, everyone. For those of you who don't know, I'm Laurie Ledley, the founder and president of Valley Sleep Center, and I'm so excited to have Dr. Eric Nofsinger with us tonight. He is a renowned sleep researcher and the founder and CEO of EB Therapeutics. Dr. Nofsinger invented the EB sleep system. Based on research, he's performed as a professor of psychiatry and director of the Sleep Neuroimaging Research Program at the University of Pittsburgh School of Medicine. His work there was focused on reducing activity in the frontal cortex through precision cooling methods to achieve restorative sleep. He is a prominent expert in the science of sleep and a past president of the Sleep Research Society. Dr. Nofsinger has spent more than 35 years practicing sleep medicine and studying the brain mechanisms of healthy sleep, insomnia, and chronic sleeplessness. He's published several clinical studies related to these topics, and he's also authored a book titled Neuroimaging of Sleep and Sleep Disorders. So Dr. Nofsinger, thank you again so much for your time tonight on the East Coast. It's 8:30 there. And I told everybody just a few minutes ago how I've been really interested in learning more. Our clinicians, physicians, providers are all really excited to learn about this new cutting edge therapy for insomnia. So welcome. We will answer questions. If you're on Facebook, you have a question, type it in the chat. At the end of his presentation, we'll open it up to questions. So welcome everybody.
Yeah, great. Would you want me to share my screen?
Yeah, yeah, go ahead. Thank you.
Okay, great. Yeah. Let's see.
I'll let you know when I can see it. Is it not letting you?
Yeah, let me.
You have the green button at the bottom in the middle. There you go.
Okay.
And then you probably want to do, yeah, that's perfect.
How is it? You can see that okay?
Yep, we can see it.
Great. Well, thank you very much. It's really a pleasure for me to be with all of you this evening to have an opportunity to talk with you a little bit about what I think is really the latest exciting discovery for the management of sleeplessness and insomnia. As was introduced, my name's Dr. Eric Nofsinger. You know, I've been in the area of sleep and sleep medicine for all of my professional career. Initially was a professor of psychiatry and a director of a sleep neuroimaging research program at the University of Pittsburgh School of Medicine. I was a clinician and treated lots of individuals with sleeplessness and insomnia. And I also had a research program where I tried to understand sleep mechanisms really from a brain and physiological standpoint. You know, what is it that makes sleep healthy? And what is it that goes wrong in individuals who have sleeplessness? And those studies then led to the development of this technology that we'll be talking about tonight. I had a long NIH research career and eventually was elected president of the Sleep Research Society in the United States. So really have enjoyed my time and am happy to answer any questions at the end of the presentation about sleep, insomnia, the mechanisms of sleep and insomnia, or the use of EB to treat sleep problems. So to begin with, we're going to talk a little bit about insomnia or sleeplessness. And among sleep disorders, insomnia and sleeplessness is the most common complaint that we see clinically. The impact from epidemiologic studies suggests that probably half of the people in the United States, if not more, have experienced sleeplessness at one point in time or another in their life. And about 20% of Americans suffer from a kind of a clinically diagnosable insomnia disorder, which is associated with severe dysfunction during the daytime. It really is a clinical diagnosis. You don't have to do any fancy diagnostic testing. You basically have to ask somebody, how do you sleep at nighttime, in order to diagnose the condition. And if they tell you, doc, I just don't sleep well at nighttime. I can't fall asleep. I can't maintain sleep across the nighttime. And it impairs my ability to function during the daytime, then that individual has a clinical diagnosis of insomnia. The management of insomnia over the years and of sleeplessness, it has largely relied on pharmaceuticals, drug treatments, hypnotic medications, for example. Things like Ambien, Lunesta, more recently Belsomra, even things like Valium, Dalmane, Halcyon in the past. All of these medications are developed to try to help individuals sleep at nighttime. And the FDA has clearly recognized that these are effective medications, but the downside of these medications is that they carry a significant risk burden. And this has been highlighted by the FDA in multiple risk statements. The concerns really are related to drowsy driving, the daytime carryover effects of the sleepiness that might still be with somebody even though they've awakened in the morning. They also tend to be habit forming. It can be hard to get individuals off of these medications once they've been started on them. They can cause confusional arousals in the middle of the night. And almost every doctor has their favorite story about some unusual behavior or sequence of events that a patient has explained to them under the influence of a hypnotic medication. So they can carry some risks associated with them. And for a long time, the field of medicine has looked for alternative solutions that might be effective, but don't carry the downside risk. The other treatment that's known in the field is cognitive behavior therapy. It is known to be effective. Unfortunately, it does require skilled individuals to apply cognitive behavior therapy. It's not as widely available as we might like it to be. And it does require a considerable amount of motivation and time on the interested individual, sometimes 8 to 12 weeks of weekly sessions to get through a CBTI, a formal CBTI program. So not ideal as a solution for the masses, if you will, a lot of the individuals in the United States who do suffer from these problems. So insomnia is a huge issue in the American public. It can create significant daytime distress, problems with concentration, fatigue, loss of energy, some mood problems, anxiety problems that can go along with the sleep deprivation associated with having sleep problems. So it's important that we try to get this addressed and treated in whatever manner we can. In this slide, what I want to do is introduce you at a very, very high level to the brain mechanisms of sleep, the pathology that exists in individuals with sleeplessness, and then tell you a little bit about how the Ebb device works. So on the left-hand side, and all of these images come from my work when I was a professor at the University of Pittsburgh and performing sleep neuroimaging research studies. So on the very left-hand side, we see the normal reductions in metabolism during healthy sleep. The background image is an MR scan of the brain, and the overlaid blue areas are the areas where there are profound reductions in metabolic activity when somebody goes into deep sleep at nighttime. This is the most restorative stage 3 sleep at nighttime that people most often associate with sleep and restoration. So in order to get good sleep, the brain has to rest, and especially the frontal cortex. The frontal cortex is where the blue arrow is highlighting. That's our executive cortex. It's the part of our brain that we're using now when we're listening to a discussion. It's the part of the brain that solves problems, where we form memories, where we think, where we plan actions. It is the executive center of the brain. We use that the most during the daytime. And in order for sleep to do its job well, that part of the brain has to go offline. It has to have reductions in activity. We're going to move to the top image. This is the insomnia sleep image, and see that unfortunately when individuals have sleeplessness and they go to sleep at nighttime, the red arrow is highlighting the red highly colored regions. That's where there's increased metabolic activity, increased activity in the brain when somebody is sleeping at nighttime. This is somebody that has insomnia, and it's often associated with the clinical complaint that, doc, my mind keeps racing. I have these racing thoughts, these worries, concerns, sometimes not even worries and concerns, just random thoughts can come at me at nighttime. My head hits the pillow, but rather than shutting down, my brain lights up. It just keeps working across the nighttime. Or in the middle of the night, they might awaken and have an inability to return to sleep because their mind keeps going. Their mind is still in the on position, if you will. So the idea then, from a treatment perspective, is can we help reduce that excessive activity that's occurring in the frontal cortex to allow these people to get deeper, more restorative sleep? So the invention behind EB, if you will, came from the concept of cooling brain tissue. So cooling brain tissue has been known in other disciplines of medicine for a long time because of its neuroprotective functions. If somebody has a stroke, or if somebody has some type of brain damage or brain injury, if you can cool the brain tissue, you can help preserve brain tissue. It's known to reduce excessive activity. So the idea behind EB is, can we use these basic principles to produce a device now that could be helpful in individuals with insomnia, but to just gently reduce that overactivity in the minds of insomnia individuals to allow them to get into a deeper, more restorative sleep. So when we did imaging studies, and now we're moving to the lower panel on treatment, we can see with the use of EB, cooling over the forehead, over the area of the frontal cortex, the blue areas now show that there are reductions in this overactivity in the frontal cortex. This is the beneficial effect of the device. This is the therapeutic principle. This is the proof of concept in the science behind the use of the device. So that was all a kind of great preclinical information that allowed us then to develop a device that could be made available to the masses, if you will, to help them with their ability to sleep at nighttime. This is an image of one of the products that's available now. We refer to this as the CoolDrift Lux. CoolDrift is the overarching name for a device that is cooling by mechanism and helps an individual to drift off to sleep. The Lux refers to, this is our first model, and the first model had a little bedside unit that was a cooling chamber. as well as a pump that cooled fluids and circulated them through a tube over to a forehead pad. So basically you have cooling fluids that go over the forehead, and then that transmits the cooling stimulus down into the superficial brain tissue, reducing that activity at nighttime. It's a very comfortable cooling sensation. The temperature of the fluids is in the high 50-degree, low 60-degree Fahrenheit range. So this is by no means freezing. This is a very comfortable level of coolness that's not going to be arousing and does produce almost a meditative-like calmness when somebody uses the device for an extended period of time. And also the clinical research studies have shown that it does allow people to get to sleep and into a deeper sleep more quickly. This is a blown up image, if you will, of the bedside unit with a dial, and you can adjust the temperature for comfort reasons. It does have a clock on it. It does have an alarm feature in it as well. And you can see a very comfortable forehead pad that fits behind the head, and it's strapped in place with Velcro, and an individual can adjust it to their own comfort level. Very comfortable to wear. Person can toss around back and forth at nighttime. When we first came out with this device, it had a lot of beneficial features. We listened to our consumers, and one of the things that some consumers wanted was a more portable unit, a more versatile unit that they could travel with, that they could use maybe in different rooms of their house, if you will. So that led to our second product that's currently now available, called the CoolDrift Versa, Versa for versatility. It's a lightweight version in which all of the cooling exists in the forehead pad itself, and there is a cord that connects it to a small battery pack and control wand. The on-off button and the temperature adjustment is all in this wand, but it's lightweight and it fits into a compact case that can, you can travel across the country, take it on planes with you. It is more portable and easier to use for those individuals, if you will, who like sleep on the go, for example. So two different versions that are available at this point in time. I just want to talk a little bit about the science behind these devices. And I think that this is where we really separate ourselves from a lot of consumer products that are out there to help individuals sleep at nighttime. I mentioned the brain imaging studies. So it's based on, over 35 years of neuroimaging, neuroscience, the basic mechanisms of sleep-wake regulation. But in addition to that, our early versions went through a rigid and formal FDA clearance process. So in the FDA clearance process, we worked with the FDA. We designed and conducted some large-scale randomized controlled clinical trials with a placebo condition, and we were able to show that there were beneficial effects, not just related to any kind of placebo, but over and above what you might see just with a placebo. These were all done across multiple centers, multiple research sites. These were all done with polysomnographic monitoring to validate whether or not somebody was awake or asleep. And you can see fairly large sample sizes, over 100 patients in each of these trials. So we have a large data set, a large validation data set, again, that led to FDA clearance in 2016 early on. In these research studies, and this comprised over 3,800 nights use of the device, there were very, very few adverse events. And here you can see, 0% for the vast majority of adverse events. And some of these are kind of funny adverse events. And we, in a clinical trial for FDA clearance, you have to list anything and everything that a subject might encounter across the course of a trial, whether it's related to the device or not related to the device. So you can see a variety of, dental conditions, abrasions to a lower lung, cramps, knee contusion. These things are obviously not related to the device itself, but these are things that happen to individuals over the course of the time that they were in the research study, and we had to report these. But as you can see, the safety profile is much, much cleaner than what you would see for any of the hypnotics that have been approved by the FDA. So the first thing that we were interested in is we wanted a safe alternative, a more natural solution for sleeping issues. So job number one, or aim number one, was completed. We now have a safe device. So now the question is the device effective in the management of sleep problems? So here I'm going to review in this one slide multiple studies that we have conducted using the device. Just to explain this graph, this is the measure sleep latency. How long does it take somebody to fall asleep at nighttime? The higher the number, the more difficult time they have falling asleep. So the red bars, the red columns, if you will, are the baseline values. This is how bad their insomnia was to begin with. Most of these individuals, it was taking them an hour or more to fall asleep. So pretty severe insomnia complaints. And with the EB device, we're looking at 6 different independent clinical trials. And then on the far right-hand side, just for your own reference, we have from the literature meta-analytic data representing a large number of hypnotic trials and a large number of cognitive behavior therapy, CBTI trials. And you can see what are the effects of hypnotics, what are the effects of cognitive behavior therapy on this measure. And then you can go back to the EB graphs and you can see how they stack up to hypnotics and cognitive behavior therapy. So across the board in all of our trials, FDA trial 1, FDA trial 2, we had a 30-day trial where individuals wore it for 30 days in their home, came back to the lab, we retested them. And then the Gen 2 trial that's listed here is actually the Versa model. That's our second generation version of the CoolDrift, just to validate that that had the same degree of effects. We also conducted a study in menopausal women. And for anyone in that gender and age group, sleep problems in menopause are very, very prominent. I think it's one of the most under-recognized challenges in all of sleep medicine. It is something that I think really needs more attention. But the insomnia associated with the menopausal years, often related to the experience of hot flashes at nighttime, and then leading to a variety of dysfunction during the daytime, maybe hot flashes during the daytime, low moods, high levels of anxiety, a lot of dysfunction that's occurring related to the sleep problems. Here you can see that there were significant reductions in sleep latency, improvements in these women's ability to fall asleep. And although I'm not showing the data here, there were also improvements in the intensity and severity of hot flashes at nighttime, as well as the appearance, intensity, and frequency of hot flashes during the daytime. They had improved moods during the daytime, improved anxiety levels as well. We just had a manuscript accepted for publication in the journal Behavioral Sleep Medicine. I'll reference that at the end of our discussion. And then the next trial that we did was in veterans with PTSD, veterans with comorbid medical problems, cardiorespiratory problems, coronary artery disease, COPD, a third of whom had sleep apnea. This is a very, very refractory and difficult to treat population of individuals with severe insomnia, severe difficulties falling asleep. This is a trial that was just published this past summer in the journal Sleep and Breathing, and I'll reference that at the end of the presentation here as well. Again, peer-reviewed publication. But when you look at all of the results stacked up next to each other, what you can see is that this is highly replicable data. The ability for this device to help individuals get to sleep has been replicated in multiple studies, both during the FDA trials and then also in some of our post-marketing studies. The next slide shows another measure of insomnia, which is the Insomnia Severity Index. This is a standardized instrument that's used in a lot of insomnia trials. It's a 7-question standardized self-report instrument that measures things like, do you think you have problems falling asleep? Do you think you have trouble staying asleep? Do you feel refreshed on awakening? Does your insomnia interfere with your ability to function during the daytime? Have other people commented on your dysfunction or on your sleeping problems? So all of those things go together. They get lumped into a single score. And if that score is 15 or above, then those individuals meet criteria for having clinically severe insomnia. On the right-hand side, you can see the impact of hypnotics and the impact of cognitive behavior therapy on this measure. And on the left-hand side, you can see 4 independent clinical trials in different populations, menopause, 2 groups of veterans that we studied pre and post-treatment, showing over 50% reductions in the insomnia severity that these individuals experience. So I think that the device then has met the goals that it was designed. It is an effective alternative to hypnotics, and it's also a safer alternative to hypnotics that now has been replicated in a number of clinical studies with peer-reviewed publications. And just for your reference to highlight the peer-reviewed, this is our initial FDA trial that was published in 2008 in the journal Sleep. The lead author on this was Thomas Roth, who's been involved in a lot of different trials of insomnia, certainly a leader in the field of insomnia treatment. So this was our pivotal randomized controlled trial, then published in the journal Sleep. More recently, as I mentioned, in June of 2020, we had a peer-reviewed publication in the journal Sleep and Breathing. This is now in published format. The lead author on this, Vince Myslevich. Vince was one of the co-authors of the guidelines that the VA uses and the Department of Defense uses for the management of insomnia problems. Tom Nyland is the leader of a PTSD program at the University of California, San Francisco. So a couple of co-authors worked on this report with me: improvements in sleep, improvements in insomnia severity, reductions in sleep latency, reductions in wakefulness after sleep onset, and they also had improvements in levels of depression and anxiety from pre to post treatment, which was a nice kind of added benefit of the device. And then finally, I mentioned the study in menopause. This was just accepted for publication. Actually, this past week, we received notice that this manuscript was accepted. It's now in press in behavioral sleep medicine. We expect that to hit the newsstands sometime in the next several months. But the co-authors on this, Fiona Baker, Max Dizambati from Stanford Research International. These are individuals who are leaders in the assessment of menopausal sleep, the description of the sleep problems that they have, as well as the treatment of sleep problems in menopause. So very happy that they worked with us on this report. So this then brings me really to the end of my formal comments for the evening. And again, I wanted to be very brief in terms of showing you the clinical results, describing the technology, which I think is changing the face, if you will, of how insomnia and sleeplessness can be managed. I'm happy to answer any questions that might have come up on anything that I've talked about so far. So thank you very much for your attention.
Great, thank you so much. So I'm gonna put you back on the screen here. Let's see, stop sharing, there we go. Hello, thank you, that was amazing, so interesting. So let's start out by asking, what are the major differences between the EB and the Versa? I know we need a prescription for the EB, but the Versa we don't, correct?
So actually, so we have one product that's a prescription product, and that's the only place that's being sold is in the VA healthcare system.
Okay.
So physicians who are treating veterans in the VA healthcare system can prescribe that. Other doctors can as well. So it is that's called the EB Insomnia therapy, and that is available as a prescription device. But the CoolDrift Lux and the Versa versions are both available for consumers to purchase over the counter. They can go to our website, ebsleep.com. They could go to Amazon, purchase it there, Bed Bath & Beyond. There are a variety of outlets where, but they are both available as a consumer version.
And we do have some on our shelves as well. So I want to draw the winner, and then let's get to the questions, because I know some people may not want to hang around for the questions, but I've got my little bowl here with like over 40 names. So thank you everyone for joining. I'm going to say your first name and your last initial, and then I will email you to get your address. All right, Lanzetta D, you are the winner. So I will email you, watch for that, and so you can send me your address so that I can mail you. So congratulations, Lanzetta. All right, we've got a lot of questions. First one, can we wear this if we're a CPAP user?
Yeah, so in most of the studies that I've described, so especially in our veteran study, about a third of those individuals were also using CPAP. So they had sleep apnea diagnoses, they'd been treated with a CPAP, and were wearing CPAP. There are certain configurations of masks that work well with EB, and there are certain ones that unfortunately do not work with EB. So sometimes it takes a little bit of adjustment. So the EB fits over the forehead, so any CPAP mask that does not have a significant presence on the forehead, you can use EB with.
Okay, all right, let's see here. What about brain injury? Have you had success with people with brain injury?
So brain injury is a very, very, it's a very difficult problem to treat, and insomnia is fairly significant. And there are some kind of organic changes there that sometimes we can help with, sometimes we have challenges with. We have individuals that have used EB and have had underlying brain injury that have had some success with it. And so of all of the various treatments, I think EB is probably the one that I would at least try. because, when you start to get into hypnotics and you have the brain injured and kind of, suffering to some degree already, you don't want to add a hypnotic medication that could confound some of the confusion, disorientation that might occur in a brain injured patient. So this would be a safer option, and cooling does have the effect. Cooling is used as a neuroprotection. So even if somebody has just suffered an acute brain injury, one of the techniques that neurosurgeons, neurologists, emergency medicine physicians will try is some type of a device to help cool down the body and cool down the brain to try to protect nervous tissue. So cooling and brain injury tend to kind of go hand in hand just from a mechanistic standpoint as well.
Okay, thank you. I don't think that any insurance covers this, but someone specifically asked about the VA. Are they covering this therapy?
So the VA, we're in the process now of having the approval. It's funny that you asked that, because I just got off a call today with the VA central office, and that's the body that evaluates different treatments. And there were actually Vince Myslovich, Tom Nyland, who were co-authors on the paper in Veterans. And then one of the lead sleep doctors for the VA were on. And there was a feeling that I had that there was going to be a movement towards the VA covering this on a regular basis. Some VAs do that, and you can get it on a fee basis through certain VAs. Other VAs are waiting for kind of final guidance from VACO before utilizing the device. We believe that that's coming in short order. And certainly, the evidence is very, very strong in veterans. So.
And then can it help them get off their meds for PTSD? Have you seen this?
So that was a very exciting finding that, we looked specifically at the PTSD population and found reductions in the level of PTSD, improvements in sleep, improvements in daytime anxiety, reductions in depression. All of those things you would think would go along with their ability to kind of reduce some of the other medications that they've been on. And in the general population, we certainly know that there are a lot of individuals who are able to use the device and reduce the dosages of hypnotics that they're on, and some are able to get off of the hypnotics completely.
Great. So someone's wanting to ask about, have any of your reports or studies reported better dreaming with this treatment?
So some, dreaming is interesting. So some people have reported that they've started dreaming for the first time in many, many years. And they don't report them as bad dreams or nightmares or terrors or anything else. It's just they're aware of more mentation when they're dreaming at nighttime. And, anybody that's been involved in understanding dreams, there are a lot of things that can impact on any time we change something about our daily life. We undergo a trauma, a stress, sleeping on a different mattress, somebody throws water on our face while we're sleeping. All of these things can impact our dreams. So whether or not it's the device itself or just something about having something novel on our head could be impacting dreams at nighttime.
Well, and I think it's important to point out that just because you're struggling with insomnia doesn't mean that you may not have an underlying sleep disorder. So it's really important that you do see a sleep specialist. Make sure that you don't have an underlying sleep disorder. And then he talked a lot about, Dr. Nofsinger talked a lot about CBTI, and Valley Sleep Center does have Dr. Adam Froese. He's our sleep psychologist. We do have a full program for CBTI. So Again, but you need to see a sleep doctor or one of our nurse practitioners who specializes in sleep first, and we will help you determine. And I'm leading into my next question that says, I'm being treated for jaw issues, clenching and grinding. We call that bruxism. My sleep study showed mild sleep apnea, but my insomnia is off the charts. I was made a medieval torture device, a mandibular advancement device, by my orofacial specialist, and it makes my insomnia even worse. It juts my lower jaw, and there's no way I can sleep with it. Would this device help with my clenching, grinding, which could be caused, or which is not helping me sleep well at all?
Yeah.
So,
So
great
yeah,
question.
great question. Yeah, I love these kind of real world scenarios. So I can't necessarily say that there's a direct mechanism between the device and what's happening in the frontal cortex and the mechanics of that's producing the bruxism. Having said that, what is probably happening with the bruxism is a sense of central nervous system arousal. So you're having these physical sensations that then are disrupting our ability to sleep at nighttime. And one would hypothesize that the device would at least allow you to kind of dampen some of the secondary arousal that's occurring from the bruxism and might make it more tolerable over a long period of time. It's an interesting scientific question. I don't have a specific study, but that would be my guess, is that it might be worth trying. And for whoever asked the question, if you do try it, please give me feedback as to how things went. So.
Let's talk about the warranty. So if we try this and we're not happy, can you explain that a little bit while I go on look at these other questions? Yeah,
so we have a money back guarantee, which is a nice thing. You can try it. If after a period of time it's not working for you, I think we're at a 60-day money back guarantee. So you can try it for a really long period of time. You can always turn it back in if it doesn't seem to be having the benefit that you would like. Having said that, there are what I would encourage for individuals that are using the device. We do have in our customer care center, we have some individuals that can kind of work with you on the best ways to use the device, the timing of when to put it on at nighttime, how long to leave it on, the settings. So there may be some adjustments and some adaptation that our customer care service can assist somebody with if there are some initial issues that someone might have with the use of the device. Most people find that the maximum benefits are really coming in weeks 1, weeks 2, weeks 3, when they're really feeling adjusted, accustomed to using the device, and it is helping to its maximal benefit.
Great. That's so nice that it has a money back guarantee, because we can't go wrong, right? We try it. We've tried everything if you've had insomnia. I know I have. Yeah. So it's exciting to know that we can buy it, and if we don't have a good success, that we can turn it back. And you want people to have good success, right?
Right.
So that's a really great thing. Someone's asking what CBTI is. It's cognitive behavioral therapy for insomnia. That's what the I is. How do we order? You guys can email me if you want, and I'll ship you one. We have some in stock. Also, he said edsleep.com or Amazon. And let's see here. I can't afford the product. I think I'll put ice on my head. Okay, we could try that. I did some cryotherapy today. That was fun. You know about that? I went in the freezing cold, like
Yeah, absolutely. Yep.
They say it's really, cold therapy is supposed to have great effects, clearly. All right.
Yeah, the ice, a lot of people ask about ice or using ice pad. The only difficulty there is that they're too cold, and then they don't last very long. Unfortunately, they tend to wear off and warm up over time. And if you're trying to sleep across the nighttime, they don't provide the coverage And the precision cooling is really one of the keys here. We did some dose ranging studies early on at a variety of different temperatures, and then finally found one that is maximally effective. So.
And the Versa model is $349, right?
That's correct, yeah.
Okay. All right. Do you sleep with it on your head all night? Someone wants to know.
So we encourage people to personalize their use of the device. You can, we at least encourage people to put it on and get used to it for 20 to 30 minutes before they actually get in bed and want to fall asleep. And then a lot of people wear it throughout the nighttime, especially if they have sleep maintenance problems and difficulty waking up in the middle of the night. So they'll use it across the nighttime. Some people find that they only need to use it to help them get to sleep, and they can take it off and sleep the rest of the night without it. Other people find with only sleep maintenance problems, they don't necessarily need to start the night with it, but if they wake up in the middle of the night, they can put it on and then use it for the rest of the night. So we highly encourage individuals to personalize it to their own specific needs.
So how long would you typically take to see results if you started using it on night one? I mean, when do we throw in the towel?
Yeah, so I would, so some individuals start to experience benefits within the first few nights. Within the first 1 to 2 weeks, someone should start to see some of the more significant benefits. And then in our clinical trials, we see improvements in the first week and then continued improvements in weeks 2, 3, and 4. I think it plateaus off at about a month, where that's kind of where we would see the maximum level of improvements.
Sorry, I muted myself. I'm on a military base, so there's a lot of activity going on out here. I think they're doing rain or whatever pickup and drop offs out here. All right, does anybody have any more questions? I will put my email in the chat. You all should have it because you got it for the webinar. And this was so great. I really appreciate the content, and I'm looking forward to being able to have something, you know, to help people with insomnia, especially with the hot flashes and being a breast cancer survivor, I should say menopause. You know, we get thrown into that at very early ages because of medication. So I think this is a great solution for women with breast cancer.
Absolutely,
you know?
Yeah.
Big heart for me, you know, a big part of my life. Okay, I'm going to go to the chat one more time. I'm going to put my email in here so you guys all have it. And I will take care of getting them shipped to you if you want one. Gosh, this is great. I can't wait to let you know how Lanzetta does and how everybody else does. And actually, if you end up with one and you want to give your testimony, I love doing little videos, and I'll make sure Dr. Nofsinger gets that. And again, I just want to say thank you to everyone. Feel free to reach out to me personally. Also, valleysleepcenter.com, that Ask a Sleep Coach box that pops up, that comes directly to my personal email. So feel free to reach out to me there as well if you didn't get my email. All right. Have a great evening, everyone. And
Thank you very much.
Thank you. Have a good one. Bye.